Hi, in this video we are more concentrating on the blood supply and internal features of the spinal cord. First of all, we are discussing the internal features of the spinal cord. The spinal cord have a inner grey matter and a outer white matter. The inner grey matter is formed of the neuron cell bodies and the outer white matter is formed of the nerve fibers. The lateral part of the inner grey matter, it is divided into mainly two horns, which are an elongated narrow posterior horn and a broad anterior horn. Additional to these horns, the spinal cord have a lateral horn, which is a part of autonomous nervous system, which can be seen in the T1 to L2 segments and the S2 to S4 spinal segments. So the grey matter seems like a H-shaped manner. The white matter, which surrounds the H-shaped grey matter, it consists of nerve fibers, mainly myelinated nerve fibers. So it gives a white appearance. Each half of the white matter is divided into three regions. It is called as columns. Which are the three columns? An anterior white column, lateral white column and the posterior white column. Each column consists of tracts, either ascending tracts or descending tracts. Can you name some ascending tracts? Dorsal column tract, lateral spinothalamic tract and anterior spinothalamic tract. Can you name some descending tracts? Lateral corticospinal tract and anterior corticospinal tract. These descending tracts are also called as corticospinal tract. Then the horns are very large at the cervical and lumbar enlargement. Why? Because to supply the upper limb and the lower limb. Maximum amount of white matter can be seen in the cervical region. So we are going to discuss the blood supply of the spinal cord. The spinal cord is supplied by three sets of arteries, which are an anterior spinal artery, posterior spinal artery and segmental or radicular arteries. The anterior spinal artery, it is formed by the union of spinal branches of the left and right vertebral arteries. These arteries join to form a single artery and passes along the anterior median fissure and it supplies the anterior 2/3 of the spinal cord. Then the second one is the posterior spinal artery. It is 2 in number. This is the posterior spinal artery. The spinal cord is supplied by the posterior spinal artery by its collateral branches and it supplies the posterior 1/3 of the spinal cord. It is the posterior spinal artery is formed by the vertebral or posterior inferior cerebellar arteries. The third one is the segmental artery or radicular artery. This is formed by the spinal branches of the surrounding blood vessels. Which are the surrounding blood vessels? The vertebral, deep cervical, posterior inferior alveolar, lumbar and lateral sacral arteries. These arteries enter the spinal cord as anterior and posterior radicular arteries along with its respective spinal nerve roots. These arteries reinforce to form a 5 longitudinal arterial trunk. And this 5 longitudinal arterial trunk, it communicates with the spinal cord to form arteria vasa corona. The anterior radicular artery, especially at the lower levels, means lower thoracic and upper lumbar levels, usually at the left, it is large. It is called as the arteria radicularis magna or the artery of Adam-Q-X. This artery of Adam-Q-X has some functional importance. It serves as the primary arterial supply to the anterior spinal artery. If any injury to this artery occurs, it will result in severe neurological deficits like urinary and fecal incontinence, impairment of motor function, while the sensory function is intact. The artery of Adam-Q-X not only has functional importance, it also has some clinical importance. It is very essential to know the location of this artery preoperatively, especially in thoraco-abdominal aortic surgery, to minimize the risk of ischemic spinal cord injury. So it is very essential to understand the artery's anatomy and its clinical importance to prevent the ischemic spinal cord injury, especially in the thoraco-abdominal aortic ripple. Thank you.